Welcome back to the Medical Fitness Podcast. I'm your co host, Jeff Young, the co founder of the Medicine Rehab and Fitness Institute and an adjunct lecturer at the City University of New York, York College in Jamaica, Queens. And with me is David Flench, president and CEO of the Medical Fitness Association. Today, we're excited to welcome Dr. Karen Wonders, a professor of exercise physiology at Wright State University, where she is the program director of the exercise science program and the exercise oncology certificate program and director of the Cancer Wellness Resource Center. Dr. Wonders is also the CEO and founder of Maple Tree Cancer Alliance. So, as you can tell, she's an expert in exercise oncology, and we're thrilled to have her here to share her insights. Welcome, Dr. Wonders.
Hi, thanks so much for having me.
Great to have you, Dr. Wonders. Honored to have you on our show. Thanks for joining us. We're excited to hear your insights and on this incredibly important topic of exercise oncology. So let's start with a broad question. For our listeners who might be new to this concept, could you explain what exercise oncology is and why it's such a critical area for both cancer patients and medical fitness professionals?
Sure. So basically, exercise oncology is a comprehensive, timeline based approach to integrating physical activity kind of strategically throughout the cancer care continuum. So, really, anytime from the point of diagnosis onward, exercise oncology can take place. And, at Maple Tree, we categorize patients according to where they are in their treatment journey. So we look at prehabilitation, which is the very beginning of treatment, from the time of diagnosis really until treatment begins. And the goal there is really to prepare patients for surgery and help them to optimize post-operative complications and reduce any of those and reduce length of hospital stay. And then you get into during active treatment where the goal is oftentimes to protect the immune system. And so we will adjust intensity so we can help the patients to do that. And then finally, we have survivorship, which is once active treatment has come to a close, getting patients who have been active while they're undergoing cancer treatment to stay active then for the rest of their life. And to do that, then we have partnerships in the community where patients can then transition and have people that they're working with in the community who can work with them and help them through.
I have a question for you. But before I ask it, I just want to give you, we're just getting to know each other. So I want to give you a little bit of, very briefly, my background on this. I don't have a whole lot of experience training people with can't either while they're going through treatment or cancer survivors, despite the fact that I have an expertise in medical fitness. In here in New York City, I was in a Mount Sinai system for 10 years where I was occasionally referred patients who were cancer survivors. And I also spent some time collaborating with, I don't know if you know him, he's a physiatrist, Dr. Jonas
Oh,
Sokoloff.
yes.
Yeah, so
I do know.
because he's here in New York City as well. So and he would refer patients on occasion, but I have some experience, but I don't have a lot of experience. And before I get into my next question, I'm just curious, how'd you get into this? Like, how did all this happen?
Yes. So I always say I didn't choose cancer, cancer chose me. Really, it all came about when I was I wanted to go to a doctoral program and I was interviewing at the University of Northern Colorado. And honestly, when you interview for doctoral programs, you're supposed to do the research and look to see what is their research, and then you align yourself with that. And I didn't do any of that. I just kind of showed up one day for an interview. I was 23 years old and just thought it'd be cool to live in Colorado, honestly. And did the interview and they kind of looked at me and they said, "Well, we think you're a good fit. We think we'd like to ask you to come to school here, but you're going to have to do research in cancer and exercise. And how do you feel about that?" And, I always say at this point in my life, I didn't know very much about cancer. No one in my family up to that point had had cancer. So I'd never had that close contact with it. And I was really intimidated by the idea. of working with a cancer patient. I had worked in cardiac rehab and I had helped people post surgery and on dialysis, all of that. But the image that I had in my head of someone who was fighting cancer, I thought, aren't they going to be too sick? Aren't they going to be too weak? Are we going to hurt them? Is this safe? But, I wanted to go to school there. I wanted to live in Colorado. So I just said, oh, that sounds amazing. Yes, I've always wanted to go and do that line of research. And 3 weeks into that program, I just kind of had this moment come over me where I had this realization that this was what I was put on this earth to do. And I can't
How
even
cool is that?
explain it. It was just one of those things where I'm like, yes, this is what I'm supposed to do. And then here I am 22 years later, still doing it. And hopefully for, many more years to come.
Yeah, no, that's really cool. And I'm really glad I asked the question. Just a quick aside, I'm actually wrapping up a doctoral program. I'm going the EDD route, not PhD in kinesiology. And the reason why I bring this up is because you mentioned that you weren't really given much of a choice as to what you could do. And in our program, we actually really are. And I've learned that in that sense, our program is somewhat unique. And I don't know if that's the answer or not. My understanding is that it's more like what you'd experience, and that when you go into a doctoral program, you're kind of given not, basically what line of research you should do and maybe some choices. Do you know if that's the case?
Well, I think that it is usually dependent upon the grant funding. So I know
Okay.
my institution, it was the University of Northern Colorado. I believe that's an R1 institution. And so the faculty that were in the PhD program all had, NIH grants that they were working on. And so my assistantship was a part of those grants. And so, that was the line of research that we did. Now we did have flexibility in terms of we would do different studies. So we had an animal lab where we had rats and we'd run them on treadmills and look at their heart function after chemotherapy. And I loved that, even though I was a vegetarian at the time. And then we also had a facility on campus where humans could come in and we would do research on like cortisol levels and, different things related to treatment and exercise. And I think what was so great was it was a newer line of research. I mean, this was back in 2003 to 2006.
Ah,
I was at the
okay.
program, but I didn't realize it at the time. I thought everyone else knew that cancer helps, cancer patients should exercise. There's all these
Yeah.
benefits, and I'm seeing all these benefits even in rats. I could look at a rat and say, well, that one must have exercised because that's a good looking rat.
Yeah.
It looked different. And it wasn't until I graduated and started, working at Wright State University in Dayton, Ohio. I thought I could just go knock on the doors of the hospitals nearby and introduce myself and go do research in their exercise oncology programs, and quickly learned that that was not a thing. And, none of the hospitals that I talked to were aware of the benefits of exercise for their patients,
Wow.
telling their patients to rest. And that's ultimately what led me to start my organization. Was when my grandfather has cancer, they didn't know about exercise to help him.
That is great. So, I'm glad I asked that question because now again, it shows that you were meant to do this and you're, part of the pioneering, it sounds like, of this. So that's great. And anyways, I digress and I need to stop digressing and get into the next question, which is obviously, as you just mentioned, exercise oncology isn't, or as you alluded to, exercise oncology isn't just about exercise, it's about integrating into a broader care plan. Can you elaborate more on how exercise plays a role at the different stages of cancer treatment?
Yeah, that's a great question. I really believe that it is so important to have exercise as a part of this continuum of care that patients get. So initially, when I started Maple Tree, I would get asked the question, oh, are you against chemotherapy? Do you think patients should, do alternative treatments? And that's not it at all. And if you look at the literature and you look at the research of patients who exercise while they're on treatment, what you find is that patients who exercise tend to have fewer dose delays and dose reductions. They have higher treatment completion rates. They have lower side effects, less severe side effects, lower hospital stays and healthcare utilizations. And so I look at exercise as a complement to the traditional therapies. And I would say since I started Maple Tree, I started Maple Tree back in 2011, and now it's 14 years later. We have seen that shift where the medical community understands the value of exercise and realizes that it should be made available to their patients. And so you're seeing these integrated healthcare delivery models more and more coming into play, which I think is such a positive step, because I believe anyone who's battling cancer, whether you're terminal or whether you're stage 0, should exercise, because there's going to be benefits no matter what end of the spectrum that you're on.
Yeah.
Karen, I remember offline from this podcast, you had mentioned that now exercise is becoming part of the standard of care. Is that right?
Yes. So, standard of care, whenever we say standard of care, that usually just means that, I'm diagnosed with cancer. And so we have these standards, you oftentimes will get surgery, then chemotherapy, then radiation. And so making exercise standard of care elevates it to that level of the adjuvant treatments that are available. And so we do have that right now with breast cancer patients. So in January of last year, 2024, the National Accreditation Program for Breast Centers, NAPBC, published new standards, accreditation standards for their hospitals, their breast centers that are accredited through them. And in 4 different places, they have exercise as part of those standards. And essentially, those standards say patients need to be assessed for functional limitations. They need to be referred to an evidence-based program, exercise program. They need to document this in the EMR, and yeah, so those patients need to be tracked and need to be followed, which is great because it goes beyond simply a box saying, try walking or try yoga. I mean, this is an evidence-based program, is what they're suggesting. And so that was huge. And then ASCO in 2022 published guidelines on diet and exercise. And guidelines are not necessarily the level of standards, but still this opens the door for then the COC to make it standard for all tumors. But ASCO said in May of 2022, any patient that's being treated with curative intent should be referred to an exercise program. So we've had some major shifts here in the way that the medical community is embracing exercise. And so the next step then would be for the Commission on Cancer to make this standard of care for all tumor types.
Good. Love hearing that, which is actually a good lead into my next question, which is one of the key elements of a successful exercise oncology program is building an effective interdisciplinary team. So,
Mm.
how would you recommend that fitness professionals go about assembling this team? And also, what are the key players that need to be included in an exercise oncology?
That's a great question. So I think that a good exercise oncology team, of course, is going to have the exercise professionals, but those professionals need to understand how they work in relation to the rest of the healthcare team. So if you look at the healthcare team as a whole, you're going to have oncologists. Well, how does an exercise physiologist relate to an oncologist? We're not going to give them advice on treatment. We're not going to say, hey, I really think that, so and so needs this chemotherapy drug. But we're going to ideally create a relationship with that oncologist so that they can advocate for the program to their health system. They can refer patients to your program. They can understand the credentialing that you have and build that trust so that they will, tell their patients to come to you. So that's number one. Then you have the oncology nurses. And when I was just getting my start, forming relationships with the oncology nurses was huge because they spend so much time with the patients. They oftentimes have the patient's trust. So if the doctor is telling them to exercise and then the nurse is talking to them about the program and they're sold out on the program and they know that this is going to benefit the patient's going to trust. I mean, the patient already trusts them. And so they're going to, follow their advice and come into the program. And so understanding those dynamics, I think it's also very important for the exercise professional to understand how they work with a rehab team. And I think traditionally there have been not clear pathways in place for where does a physical therapist end and where do I begin? How do we triage patients? How do we share patients? Is that even possible? And so one of the things that we do at Maple Tree is any patient who comes to us, we automatically triage. And the tool that we use for that is it's a questionnaire that was developed by Kelly Wood, who is an onco-trained physical therapist in this space. It's called the Exceeds questionnaire. And basically, the way that the Exceeds is set up is there's a red box, a yellow box, and a green box. And so red light, yellow light, green light. And if a patient answers any questions in that red box, that means we're going to refer them to physical therapy. This is beyond the scope of practice for an exercise professional. We refer to you. They can sometimes do exercise in parallel to physical therapy. Other times it's in tandem. It's really up to the patient and what they prefer. But then that yellow box is we can do supervised exercise training. And then that's where the exercise professional comes in. And then we have the green box, which is they're free to exercise in the community-based setting. And that's generally for people who've completed active treatment and can, transition into the community. But having that in place oftentimes will break down that barrier because sometimes I think our guard goes up and we think, are you going to work with me? Are we going to be friends? Or how's this going to work? But being able to show them, no, this is the tool, this is how we triage. And oh, by the way, 43% of our patients we refer to physical therapy. Then they see like, oh, this is a friend, this is a colleague, we can work well together. We're both on the same team. We both want to help patients and see them thrive. And I think that is the way to really work as part of an interdisciplinary team.
This is perfect. Again, at the beginning of today's podcast, I mentioned that I co-own a company called the Medicine Rehab Fitness Institute, and that's literally exactly what we're about. It's with a physician assistant and a physical therapist colleague who's also a co-host of this podcast, Dr. Thomas Hammett, and that's what we're about. We educational material and presenting at conferences, etc., on how to move patients through that pathway when physical therapy is appropriate, which is very often. And another thing that you hit on, which was perfect, is that trust factor and the trust gap. And I'm actually presenting in 2 days at the Medical Fitness Association's Northeast Regional Summit, and my presentation is mostly on the professionalization of the fitness industry, but I'm absolutely have some slides on the importance of trust, and we need to bridge that gap. So that was perfect.
I love it. And I think it's important for exercise professionals to hear because it's not really touched on a lot in university settings. I think it will be, as we have more of a clinical presence, but learning how do you operate as part of a clinical team? How do you build trust with the healthcare team? But then at the same time, how do you build trust with your patients and how does all of that work together? So I love that. I think it's great that you're talking about it because I think it's something that we as professionals need to hear and need to rehearse the importance of building that trust.
Yeah, and get this. Yeah, I'm an adjunct lecturer, and I teach strength and conditioning, exercise prescription for special pops, which includes a lesson on cancer.
Yes.
Um, in sports medicine and rehab, which is the orthopedic side, and I teach a couple other courses as well. But I drill into my students' heads, especially in the exercise prescription for special pops and the sports medicine and rehab, the importance of collaboration. And yeah, so anyways, I could go on and on, but I'm really passionate about this topic.
The Medical Fitness Podcast is brought to you in part by the Medical Fitness Association. Are you a professional in the medical fitness industry? As a member of the Medical Fitness Association, you'll unlock exclusive networking opportunities with top experts in the field. Access cutting-edge education to stay ahead of industry trends and best practices. Don't miss out on the chance to advance your career. Join the Medical Fitness Association today. Visit medicalfitness.org to become a member. That's medicalfitness.org.
I love it. That's great. And, I have found with my students, a lot of times they're intimidated to talk to the healthcare team.
Yes.
It's a physician, it's an oncologist. Oh, they're so smart. Oh, and they get so intimidated. And so I think just teaching them, here's what your relationship should look like. I mean, it's a professional relationship. You're not going to give them advice. what you want is to build your credibility, build the credibility of the program, and have them refer patients and have them just, become advocates for exercise. That's what we're
Absolutely.
looking for. And I think when you can define that out, it makes it a little bit easier, is they know, okay, this is the intention here. This is all I really have to focus on.
Yeah, and David, I don't mean to block you out here, but one last comment. I'm very fortunate that I was on that side of the fence where when I first started at Mount Sinai, I was scared too.
Mhm.
Oh my God, these are doctors, and so I'm able to personalize it with my students or whoever I'm talking to and say, hey, I've been on that side of the fence. I know what it's like, but it ends up that no, there are ways that we can build that trust, bridge that gap, get and that you personally can build confidence and realize that you know what. It isn't a totem pole situation. It is a continuum situation, and you're a very important part of that healthcare continuum and healthcare team.
Yes, exactly. And when they see the value that you can bring to their patients
Yes.
and helping them to feel better and to make it through their treatments and reduce their delays and reductions, that is so important. I mean, you're a very important part of that healthcare team. I mean, I've had cancer centers say to me, we could not imagine running our cancer center without you. Like that's how integral Maple Tree has become, and just exercise in general has become.
Awesome.
So pulling on this thread just a little bit more, because you're describing the ideal situation with, the team working well together, and it's awesome when it does, right? But then you do have exercise professionals who maybe aren't as confident in doing that, and so there are challenges then when these teams are trying to work together. You've already mentioned a few things, but how can the fitness professional overcome that type of challenge?
That is a really good question. I would say number one, do your homework and know what you're talking about and be confident in what you know. Because if you're confident in what you know, that is going to go a long way. And then what I would say, and this is kind of the path that I took, because I too was intimidated. I mean, I had a PhD, but I was not a medical doctor. I mean, and I still, I was holding them to high regard. I mean, you're a medical doctor. If
Right.
someone has a heart attack, I'm not going to be much use to you, but this person is. And so I had that intimidation as well. And for me, I found the more comfortable I got talking to nurses and to social workers, the more I could kind of rehearse and practice what I was saying and how I was kind of selling the program, selling meaning like getting people excited about it, wanting to talk about it with their patients. And you start to see similar questions kind of start coming up over and over again. And so that helped to build my confidence. It wasn't until 2020, so we were in operation for 6 years before I had a medical director join my team. And that really, once we had him join, Dr. Jay Harness, he's a retired breast surgeon, has done a lot of work nationally and internationally, in the world of breast cancer and now with exercise oncology. But I think having him come to the table with me, and we would have phone calls talking to a new hospital, trying to get them to start a program, and then once we had a program, we would join calls together talking to the physicians about the program, how to make referrals, what are the outcomes that they should expect to see. And having that medical doctor on that call, it really did help, not only with my confidence, but I think it kind of elevated the status of the program as well. That, like, here's a medical doctor who's kind of put his stamp of endorsement on the program. He can talk to the medical side of things. I can talk to the exercise part of things. And that really helped me. Now it's to the point where I'm very comfortable having those conversations, and I don't necessarily need that, but it took me a long time to get to that point. And so I think it's okay to, have people that are going to help you. I'm happy to help. I mean, you can call me. I can help you, through that process, because I want to see people succeed in this. If other people are succeeding in exercise oncology, then the field as a whole is going to succeed. And so we have to help each other. We have to support each other for the overall good of the field.
You just hit on something else. The medical director at Mount Sinai, he
Mm.
used to one of his big phrases was success breeds confidence and confidence breeds success. And I would add to that and say having a good knowledge base helps
Mhm.
to breed confidence, and then which then breeds success. But you pretty much hit on that as well, and the importance of that, and the fact that just like with anything, there's a learning curve. You are unfortunately going to start probably on the lack of confidence side of the continuum. Maybe not everybody, but look, I was there too, etc. And for me at Mount Sinai, I was actually attending in services. And another thing that you really hit on was I started to see the same thing. It was pattern recognition. I started seeing the same thing repeated over and over, which then gave me confidence because I started realizing, oh, so these are like fundamental principles that you guys are talking about. And this lays the foundation, and that really gave me the confidence. And also just hearing them talk and maybe debate with each other, or whatever the case may be, and realize, okay, so not everyone has the answers, but there are underlying fundamental principles, and all those little things help to give me confidence along the way.
Yeah. I agree. I think that's so true. And along those lines, I have one of the things that I do during the school year is an exercise oncology webinar series. And so it's completely free. It's every other Thursday night. But people can join, and I talk about different topics like how do you fit in an interdisciplinary clinical team? How do you build trust with your patients? How do you communicate? Like all of those topics we talk about from the perspective of I'm an exercise professional. I want to work in this field. What does that look like? And so, I would offer that as well, because the whole purpose of that series is to help people feel more confident working in this field. And so, that's another resource that can be made available.
Yeah. Yeah, gaining the knowledge and expertise. That's, and it's a great segue because Dr. Wonders, one of the key offerings from Maple Tree Cancer Alliance is the exercise oncology instructor certification.
Mhm.
So it's especially exciting for us at Medical Fitness Association because we partnered with your organization just a few months ago now, and offering that certification to our members with a discounted rate. It's something that we have a passion of educating our members to give them that type of credibility, and allow for the trust to happen on these teams. So I was hoping that you could tell the listeners a little bit more about the certification, what it covers, and how it really can help build the skills that fitness professionals need to support cancer patients through exercise.
Sure. So the exercise oncology instructor certification is a certification that I wrote actually back in 2013 as I was just getting Maple Tree up off the ground because, at the time I still work as a professor now, but at the time I would have mainly my students. They would graduate from my program and then they would intern at Maple Tree, and most of them would then go on to work at Maple Tree. And so I knew what they knew when they graduated, and I knew what I needed them to know to work with a cancer patient. And so that's why I wrote that certification as a way to train and prepare people. It has evolved over the years, but with the growth and the momentum that we see in the field of exercise oncology, we have started to offer this certification more on a commercial basis. And the idea there is to train and certify people so that you can work with a cancer patient who is in active cancer treatment. And so we cover, I mean, not to the level of you're an oncologist, but it is important to have a baseline understanding of cancer. What is cancer? How does it develop in the body? What are the different typical treatments that someone would undergo who has cancer? And what are those side effects? And then we look at exercise and how can we use exercise to help attenuate those side effects. And so like what do different exercise prescriptions look like? How do you prescribe intensity to protect immune function? Or when someone's having a bad day on chemotherapy, what does that look like? So we cover that whole gamut. But again, that's going to be appropriate for someone who is in active cancer treatment. And then we have another certification that we partner with Livestrong on called Cancer Fit, and that's another certification we offer through MFA. And the Cancer Fit certification is going to be appropriate for someone who works in the fitness industry, who may or may not have a 4-year degree in exercise science. This certification prepares you to work with someone who's a cancer survivor. So someone who has completed active cancer treatment, they're ready to exercise in the community. There are so many benefits to patients who to survivors, people who've completed treatment, who are in remission, who continue to exercise. I mean, we see reductions in cancer recurrence. We see reductions in all-cause mortality and cancer-related mortality. So it's so important that we keep these people moving once we get them moving. And so those are the two certifications, and kind of the like where one ends and where the other one begins, cut off there.
I love that you've covered kind of both sides of that, because I have in front of me some of the statistics that you provided. New cancer diagnosis each year in the U.S. 1.8 million new diagnoses, and then the benchmark is 30% of those patients participate in exercise oncology programs. So we're talking almost 600,000 people each year, and at then the number of appointments that those patients need to complete in a 12-week program is over 7 million appointments. So we're talking, the number of exercise certified instructors needs to be over 50,000 each month to carry out the appointments. And so that speaks to me of the need for programs like this. So you have the people who are going through active treatment, but then, after they're done, survivors, that number just keeps growing.
Oh yeah, there's 20 million cancer survivors in the US right now. And so those numbers are based on a third of active cancer treatment. Like I'm diagnosed and I'm going through treatment. If a third of those people exercise, we need like 50,000 trained and certified professionals to meet that demand. So you can see very quickly that as momentum in this field grows, we're doing a disservice if we're not trying to build a workforce, because what's the point of trying to get it to standard of care, to trying to get insurance to pay for this if we don't have the workers? We really, and that's why I want to do partnerships like this with MFA. And that's why I have the webinar series, is to get people to consider this as a field. I found a lot of my students, and I'm just as guilty as this. When I was an undergrad student, I thought, well, maybe I'll go to physical therapy school. Well, maybe I'll work with a sports team. Exercise oncology is not typically something that someone thinks about initially as a student in this field. And so you've got to introduce it to them. Oftentimes, initially, when they hear it, they're intimidated by the idea. And so breaking down those barriers and saying, this is what it looks like. Here's what it means. Here's what your day-to-day life would look like. Here's the impact you can have on someone, I think is so important.
This is a great segue into my next question, which I'm going to switch gears with the topic a little bit. The topic is now developing programming for cancer patients. But before I ask you the question, let me say that if you don't mind, I would love to live stream you in sometime to present to my students for exercise prescription for special populations when we get to the cancer lesson, because this is great stuff. I would love for them to hear that. But that's an aside. Let me ask the question. When it comes to programming, developing the right type of exercise protocols is crucial. How do you recommend medical fitness professionals design programs that integrate well with the broader cancer care continuum? Are there certain factors or benchmarks to consider?
Yes, that's a great question. And so the way that we approach exercise programming is going to vary depending on where the patient is in the treatment trajectory. So you have prehab, which is time of diagnosis till treatment begins, or till surgery usually. So neoadjuvant chemotherapy might be a part of that. The thing that we're trying to focus on there is to get them ready for surgery. So if you have poor cardiovascular function, poor muscular strength, poor muscular endurance, you're not going to do well in surgical recovery. And so sometimes you get a window of a couple of weeks where you can start a program, kind of start laying that foundation of, here's how we're going to be healthy, here's how we're going to support you and keep you active during treatment. And you can get some time in to help them, with protein synthesis and building that strength prior to surgery. So that's that main goal there. And then when someone is in active treatment, so chemotherapy or radiation, the big thing there that we want to do is protect their immune system. So if their immune function is too low, then when they go in for treatment, they're not going to be able to either get chemo that day. They're going to be sent home and say, come back in a week. Hopefully you'll be feeling better then. Or they'll say, instead of giving you this much of a dose, we're going to cut it in half and we'll just give you this much of a dose. So those are called dose delays and dose reductions. Anytime that happens, it happens all the time, it makes it harder to beat that cancer into remission. And so you want to try to avoid chemotherapy dose delays and dose reductions as much as possible. And we have found that with exercise, what we do is we do a lower exercise intensity. So usually between 40 and 60%, depending on what the patient is able to tolerate. Everything's individualized to them. But keeping the intensity lower helps protect their immune function. And what we have found, we have published data on this, is between 15 and 20% of the time, we're able to reduce those dose delays and dose reductions in patients who exercise. So they can tolerate their treatment better, they can get more of the medicine that they're supposed to get, and they have less severe side effects. And then, of course, once they're completed with treatment and they've entered what we call survivorship, just meaning they're not in active treatment anymore, then the goal is to build their self-efficacy and to get them to understand the benefits that exercise can have. And so we work with them to get their exercise intensity up higher, but then also so that they can exercise independently and they know what to do. And, they can walk into a fitness center and not be intimidated by the machines and the different people and everything. We really try to empower the patients so they exercise for the rest of their life. That's the goal there, is for the rest of their life, we want them to stay active.
I have a quick question. So when you mentioned, you said dose delays and dose reductions. My first question is, I'm assuming that's part of the certification where
We
you'll
talk about that. Yes. Yeah.
Yeah. And the reason why I ask that is because one of the things I tell my students in the special populations class that I teach is that when it's the first time prescribing exercise for something that you're not familiar with. In this case, we're talking about cancer. It could be pulmonary hypertension or whatever the case may be. If there's kind of like a standard list of things that you want to educate yourself on, and it kind of starts with just the introduction of the condition itself, the etiology, the pathology, pathophysiology. Then we start getting into the stages that person might go through. But ultimately, what it leads to when it comes to programming is really what you're touching on, which is the special considerations, the precautions, and the contraindications. And here you're talking about, in my opinion, it falls under the umbrella of special considerations. And the reason why I bring this up is because I think it's crucial. Because when I was in this Mount Sinai system and was first receiving referrals that were cancer survivors or that were going through cancer treatment, I wasn't given this information. And this is critical information.
Mhm.
And so I didn't know how to adjust. I didn't know auto regulation or, reducing intensity based on things like this. So I just want to ask that because I think it's absolutely critical
Yeah.
for people to know these things. And it should just be more common that exercise specialists are being taught these concepts.
Yeah, I agree. And we do. So in the exercise oncology instructor, there's course material that goes along with that certification. And we touch on all of that material, because it is, I mean, it's almost like learning a new language.
It's
When
exactly right.
and I think that's why sometimes people can be intimidated by it. And I know
Yes,
that I was, because I thought I was going to get sued working with a cancer population,
exactly.
no. And so I think it's important you don't have to have an oncologist level of understanding, but it is helpful to know, hey, this class of chemotherapy can cause peripheral neuropathy. And one of the dangers to that is it can throw balance off, make it harder for patients to walk on a treadmill or to do lower body activity. So you need to know that so that you can design the exercise program accordingly and spot them when needed, and don't do anything that's going to get them hurt. And it probably is intimidating to start out. And that's why one of the things that I really care about is not only certifying people, but then helping them, partnering with them. And we have exercise program templates that we can give to people that we partner with. And it's like, if you have a breast cancer patient, well, here's a template that you can use, and it will list contraindications, exercise intensity, some good exercises you can do based on different abilities of the patient, just as a way, having the certification, I think, is one thing, but then doing it,
Oh, absolutely.
sometimes like just getting started and working in the field can be intimidating. And so giving them the resources that they need so that they can succeed, because you have those initial successes and you learn, and then before long you're not even thinking twice about it. It just becomes second nature. But it's important to have that support initially when you're just getting started.
Love it.
And one of the things that you said that I want to touch on was I think you said 15 to 20% improvement on that dose delay and dose reduction. And it kind of reminded me of what you said earlier, how a couple decades ago, healthcare and doctors didn't know so much about how good exercise was for people undergoing treatment or even in survivor of cancer. And so I wonder, if that can be now part of the conversation, that, exercise at the appropriate levels, can have a great impact on, getting somebody through their treatment in a more timely fashion, as you said, beat down the cancer um, during treatment. And so I just wonder, is that that seems to me like something that could really hit home with the medical community. And I'm guessing they don't have necessarily as they're not informed on that as much now. Would you agree on that?
Yeah, I mean, so that was actually a study that we published, and that was on people with advanced cancers. So we looked at stages 3 and 4 cancers, which sometimes when we're trying to get referrals from physicians, they'll refer like the stage 1 and the stage 2 people to us, which is fine, but we want, everyone across the trajectory. So we want to work with anyone, any age, any stage, any type of cancer. And so that's why we did that study, and we looked at 27 different tumor types and the different chemotherapy regimens that they were on. And then we compared them to sedentary controls. And we saw a 15 to 20% reduction in dose delays and dose reductions for patients who exercised with the advanced cancers. And, I share that anytime I'm talking to a new hospital and trying, to generate a partnership and get the physicians on board for that. So I think I think it's important for us as exercise professionals to know the literature so that we can really speak to the fact that this goes beyond simply feeling better. There are molecular and protein level changes that happen when somebody exercises that does support recovery in cancer treatment. And of course, it's not across the board. It's not going to cure everyone of cancer. Cancer is still cancer. But I will say, in my experience with my grandfather, I mean, he had a terminal diagnosis of cancer. It was 5 weeks from the time that he was diagnosed to the time that he died, but he was still able to exercise. Now, that exercise looked a lot different, in his final days. Sometimes it was just walk around the downstairs of your house and that's it. But even that gave him strength for that day. Improved his mood. He had stopped eating and then he started eating again, and he was able to say goodbye to his family and things like that, like tangible things that you can't really quantify. I think is so important for not only the medical community to understand, but also the patient community as well. Because I mean, I'll say in our experience, 90% of the patients we work with have never exercised before. So it's a tough sell. Well, no, I just got diagnosed with cancer. Now you want me to exercise? Are you crazy? And they think they can't do it. And then what's it going to look like? What are you going to make me do? I once had a patient tell me she was more afraid to come to Mapletree than she was to do her chemotherapy. And so they need to understand as well, like, this is going to help you. I want this to be the best decision that you've made during your cancer treatment journey. And, understanding the literature, understanding the research, and being able to speak to it, I think is kind of that first step into getting people like, oh, so this is going to help me, let me give it a try.
Okay, so my last question is for our listeners who are looking to implement or enhance exercise oncology programs at their own facilities. What are the top 3 practical strategies or actions they can take today to get started?
Well, I think we've covered them in the podcast. I think number one is getting educated, getting credentialed. So get a certification for sure. And then learn where you are on that healthcare team and build that credibility, build that rapport with the physicians, with the nurses, with the social workers, with the rehab team, and kind of understand your role there. And then I think the third most important thing is talking directly to the patients and getting the patients to trust your program, to know that you're credentialed, to know that you can help them. And the way that we have done that is by patient testimonials. And we, have a patient who's been through the program share about their experience and share about tangible things. As exercise professionals, we care about, oh, we improved their muscular strength by 18%. And that means a lot to us. But what the patients can tell another patient is, hey, because of this, I was able to continue working. Because of this, I was able to plan my daughter's bridal shower when I didn't even know if I'd be able to attend the wedding. And tangible things that are going to matter to the patients, I think are really important. So I would say those top three things, if you can do those well, you're going to have a successful program.
Good.
Fantastic. Dr. Wonders, thank you so much for your time and expertise today. This has truly been an enlightening conversation, and I'm sure our listeners will walk away with invaluable insights into implementing exercise oncology programs at their facilities.
Yes, thank you so much, Dr. Wonders. It's been an honor to have you on. For our listeners who may want to get in contact with you, maybe by social media, what's the best way they can do that?
Sure. Well, thank you for having me. And yes, you can find me on Instagram and TikTok under Maple Tree Education. And then also mapletreecanceralliance.org is my organization's website.
Well, thank you again. And to our listeners, thank you for joining us on this episode of the Medical Fitness Podcast. Be sure to check out the MFA website at medicalfitness.org for more resources on exercise oncology, especially the Maple Tree Cancer Alliance certifications. And we look forward to bringing you more great conversations next time. Thank you again.
Thanks.
This episode of the Medical Fitness Podcast is brought to you by the Medicine, Rehab, and Fitness Institute. The MRFI has been co-founded by medical, rehab, and fitness practitioners who see the medical necessity in getting people to be more active and fit. There is a sleeping giant of opportunity to building a more active population, an opportunity which lies in a more effective medical referral pathway to exercise programs and professionals equipped to serve that pathway. To learn more about our services and how we're working to make this a reality, visit mrfinstitute.org. That's mrfinstitute.org.